Hello everyone, and welcome to this sixth and final module in the webinar series on geo-enabling health information systems. This series is hosted by the UNICEF East Asia Pacific Regional Office and Moru Tropical Health Network with support from TechNet 21. Please note that this session is being recorded and that we will share with you the links to the video as well as the presentation slides later on by email. Feel free to introduce yourself in the chat box, tell us your name, where you're from. You can also use the chat box if you need any technical support, and I will be here to assist you. If you have any question during the presentation, please use the Q&A box, which is available at the bottom of your Zoom window. Feel free to ask your questions at any time, and our panelists will answer them in writing whenever they can. I hope you will enjoy this session, and now I will give the floor to Sunny. Sunny, the floor is yours.
Thanks so much, Gigi. Colleagues, once again, welcome to today's edition of our training. Excitingly, is the last module of this series of webinars trainings. We are happy to have you. We are happy to see that you're able to stay to the end of our training. For today, we will be wrapping things up. We have packed, interesting agenda for the final bit of our training. But just a quick reminder that the objectives of this webinar had been to demonstrate the potential of geospatial data and technologies in public health, and also to introduce you to the HIS Geo-enabling framework and its implementation in your countries, and to ensure there is adequate transfer of knowledge and expertise, including the skills and resources that will enable you, to implement the HIS Geo-enabling framework in your countries. Just as we had promised earlier, for people who are able to attend the training or through, the certificates will be issued at the end of this workshop today. And also, there was going to be an evaluation section. We put a link on the chat where we were able to evaluate the entire modules of our training altogether. But for the section today, this is it. For the section today, click on the link, please, and attend to the evaluation questions as, Dr. Steve take things up and give us the training for today. I'm going to call upon Dr. Steve to give us the final training for Module 6. And please stay put while we listen to Dr. Steve. Steve, please.
Thank you, Sunny, and welcome once again, everybody, to this sixth and last module of this regional training series. Few reminder as usual, all the workshop material is accessible online, will remain accessible after the end of these modules. So you have everything posted, including the presentations, either in the Google Drive or together with the recordings in the link that you have here at the bottom, which I will put in the chat as well. So you have a specific web page on the Health GeoLab website where you can download, have access to all the presentations as well as the recordings. You have here also the mention of the glossary of terms that we have been using during the whole series. If you still have some terms that seems unclear during today's module, you should be able to find the definition in that glossary. Geraldine has been mentioning about the Q&A and also the use of the chat that you can also use to share any resources or experience that you feel relevant during today's presentation. We have also set up a Google form for those who are willing to ask questions more privately, also putting the link in the chat. And I will be answering those questions after the end of this module. So if you want to ask something specific, you can also use this Google form in that regard. A little bit of recap of what we did during the previous module before starting the one today. So module 5 was dedicated to geospatial technologies. So after a general introduction to all these technologies, we focused on 3 specific ones. The first one being the Global Navigation Satellite System, or GNSS. Then we looked at Geographic Information System, both from a software and also an information system specific perspective. And the last one, we looked at these concept of registry, sorry, in common georegistry for the hosting, management, maintenance, and sharing of master list, and also geospatial data and hierarchies that are core to public health and also other sectors. So today we'll look at an additional specific set of topics going back to the whole process, the implementation process of the HIS Geo-enabling framework, and which concerns really the development of an action plan aiming at filling the gaps observed during the assessment that is being performed at the beginning of the overall process, and also implementing this plan, assessing its implementation. And we will finish today with some recap in terms of resources, the main resources that have been shared with you during these modules, and an additional few ones that could be interesting for your own respective program or intervention. So let's start by going back into the process. I will show you where we stand in that implementation process, which, I mean, for those who have been here from the beginning, you might remember we start the overall process by identifying the actual priorities, challenges, or needs or gap of a particular program or intervention. This is the step A here on top of the process. And this particular step allows to identify if geospatial data and our technologies can help addressing some of these challenges or priorities or needs. If this is the case, then the process goes into the next step, step B here, which is to understand the geographic context, right? The geography of the program or the intervention, defining the GIS-based products that will be useful to support decision-making and planning for the program or the intervention, and also look at the type of technologies, I mean, equipment, hardware, and software, as well as the technical expertise that will be needed to generate those GIS products. And so these 2 steps are specific to an implementation at the program or the intervention level, and then starts the really the loop, which look at all the foundational elements of the HIS Geo-enabling framework to ensure the long-term sustainability of the investments. And there, this particular part of the process starts by an assessment of the current level of geo-enablement of the health information system. Based on this assessment, can determine if everything is in place or not. These have been covered in first set of modules of this training series. And now we are basically going back here after looking more in detail about what needs to be done in terms of the content to ensure that you have a content of quality. That was module 4. And then in terms of what you need to be knowing about or looking into when it comes to technologies, which was module 5. Now we are going back into the process here towards this step that aims at defining specific strategies that should be implemented to fill the gaps that have been identified during the assessment. So this is really a step that we go through in a way before developing the plan itself, because the plan, I mean, you might have to develop several plans, right? You might not be able to basically cover all the gaps at once. You might have to prioritize what you want to be working on as part of the plan, and therefore these steps, looking at defining which strategy you will be using, might help you select which one of these gaps you will be basically covering during that plan. So there are different types of gaps, right, that can be filled. There are gaps at the level of the 9 elements of the strategic framework, but you have an example here in relation to the governance mechanism or the governance structure, which is one of the 9 elements of the framework. And as part of the assessment, you might have come up to basically identifying that currently the health system in your country has a governance structure that exists, but it's not operational, right? So the gaps that remains to be filled actually correspond to the next step in the continuum that have been defined for each of these elements of the framework. And the idea is, okay, which strategy am I going to be following in order to pass from this current situation here to the ideal situation where the governance structure is not only fully operational, but is also, in this case, participating in what we call the national spatial data infrastructure, in case there is such infrastructure in place in the country. So this is the kind of gaps we are trying to fill from the perspective of the 9 elements. And then there might be also some data availability, quality and accessibility specific gaps that have been identified also during the assessment. And you have an example here for 3 types of data: health facility master list, road network, and also population statistics. So this data here in this case is available, but there are some quality issues or accessibility issues, and therefore there is a gap that needs to be filled in order to be able to use this data to generate product of quality, that product that will be supporting planning and decision making. So again, also a strategy needs to be defined in order to fill that particular data gap. There is also a need at the same time to define at which level this strategy can be implemented, because some can be implemented directly at the national level or the central level, but depending on the size of the gap, there might be a need to start by a pilot, right, to implement that in a limited part of the country, and then in the second phase to scale that up to reach the national coverage. Of course, the level of implementation of each of these strategies will depend on the country-specific context, including the size of the gap versus, of course, the availability of resources to fill this gap. And what generally we do if there is a doubt in terms of the feasibility of a national implementation at first, in the doubt, we always prefer to start with a pilot, and which can be scaled up with the additional advantage that the pilot might help reveal certain things that were not known previously or identified during the assessment. Now, in order to help countries to define these strategies, we have developed an annex in the HRS Geo-enabling toolkit, which is one of the documents you can find in the Google Drive, and I'll give the link also at the end. Talk again about the resources. So Annex 5 of this toolkit provide a non-exhaustive list of potential strategies that can be implemented in order to address some specific gaps, and these across the 9 elements of the HRS Geo-enabling framework. So this annex is organized as a table. I'll show you this table in more detail in the next slides. And what you have there is for each potential gap, you have a potential strategy or set of strategies that are proposed to fill that particular gaps. There is also some indication of the minimum list of stakeholders to be involved in the implementation of this strategy. And there is a suggestion in terms of the level of implementation of such strategy. Of course, this is a starting point. This is a non-exhaustive list. of strategies, but this is based, of course, on the implementation of the framework in a set of countries over the past years. And that should already cover majority of the gaps that you can expect to find in relation to a particular program intervention, but also for the whole health information system in general. So I'm not going to go into detail about these the content of this different table, just showing you here an example. You actually have all the table in the slides, put them there for reference for those that will be watching the recording afterwards. But as you can see, it's organized according to the framework elements. You have potential gaps and how you could be filling these gaps through a specific strategy, indication of the stakeholders to be involved, and also recommendation or suggestion of the level of implementation of these strategies. So you have the same thing across all the 9 elements of the HIS geo-enabling framework. So this is the first step towards the development of this action plan. Once these strategies have been identified, it's then possible to go to the next phase, which is really starting to look at developing the action plan itself. Based on the result of the assessment, based on the strategies that have been identified. So this is correspond to step 3 in the whole HIS geo-enabling framework implementation process. And what is expected, of course, at the end of the implementation of these steps is that the Ministry of Health, in collaboration with partners, will have a clear and costed action plan that contain all the information that are needed in order to fill the gaps that have been identified, and therefore also support the successful implementation of such a plan. All the information that goes in the plan comes from all the information that have been collected, identified from the beginning of the process, right? And you might remember, during first and the second module, we looked into this and how the HIS geo-enablement level assessment questionnaire is being used to identify priorities, challenges, and needs of the different programs and interventions in the Ministry of Health, how this information also serves as the starting point to develop and document, identify and document the geography of each program and intervention, and also serve as a starting point to define the products, right, GIS-based products that should be developed in order to support planning and decision making. And these products are defined in terms of their purpose, their audience, content, and format. And then these products provides the list of the data that is needed in order to generate them, as well as the equipment and expertise that has also need to be in place in order to use that data to generate this product, to address these priorities, challenges, and needs. And last but not least, of course, the assessment of the current level of geo-enablement across programs and the identification of the gaps. All of these 6 pieces that you have here that are collected and assembled during the previous step of the process are contributing to filling the action plan to be able to address those gaps. So ideally, this action plan should at least contain what you have listed here. The first thing which is important is a vision. It can be a short and or a long-term vision, right? Where do you want to be in 2-5 years from now when it comes to the management and use of geospatial data and technologies? The objectives that are to be achieved as part of the plan. Again, they might be, for the moment, either a subset of objectives depending on the size of the gap, or it could be really objectives going until reaching the vision, the timeline, of course, start and end date, as well as who is in charge of implementing this plan. If there was several versions of the plan, it's important to capture also the date of the last update of this plan. And then for each element of the HIS geo-enabling framework, the 9 elements of the framework, the set of informations, and I will go into more detail to present this as we go during the session this afternoon, capturing information specific for each of these elements in order to implement the strategy that has been defined, and therefore, once again, filling the gaps. So in order to help the process, we have, as the Help Geo Lab, we have developed a template, which is accessible from the toolkit, or you have the link also from the slide here. That's a template which is in an Excel format. So it's an Excel spreadsheet, which is organized in such a way that you can capture all the elements that were mentioned in the previous slide, as well as use also this worksheet to monitor the implementation of the activities that have been defined. So you have here different sections in this plan. I mean, you recognize the elements that I was mentioning earlier. So they are all included here. So the upper part is the information, the general information about the plan itself. And here you have an example for one of the elements of the framework, right, which is governance structure here, with different information that have been captured about these particular elements, including the strategy, as well as then the detail of each of the activities to be implemented in order to fill those gaps that have been identified. So the elements which are highlighted or surrounded by the blue color here are to be defined as part of a consultative process, generally involving those that were part of the assessment, as well as the partners. It's good to include also the partners which are supporting the programs. The part which is in orange here is directly coming from the result of the HIS geo-enablement level assessment and the strategies that have been defined. So all the things that have been, again, documented in the previous steps of the process are then directly integrated into this template and therefore reused for the development of the action plan. The process to fill the template, so there are different approaches that can be used depending on the country context. And we have been already using some of these methods. This can be done either in person or through a remotely organized workshop involving all the relevant stakeholders. I mean, that's the ideal approach, I will say, if you can have everybody in a room during one day or two, go through first validation of the result of the assessment, identification even of the strategies, and then use of all of these for developing the action plan. That's the most efficient way, especially if you can do that in person. Now, this being said, and this has been done also in other countries, you can very much also have a smaller group that is identified, right, with representatives from the different programs, as well as potentially external partners. This small group works on a draft action plan, which is then reviewed and approved by all the concerned stakeholders. So this is also a possibility, and I'm sure in between you have other potential ways to implement also the different approach to reach the final action plan. In any case, what is good to generally do is to follow the steps that are mentioned here once the approach has been defined, which is first to start by really having an agreement on the short and or long-term vision, what is it that you want to achieve and by when, because that's what will really drive the content of the plan. Based on this, you can develop specific objectives, and then you will transfer the information that comes from the assessment into the template. You will then also transfer the strategies that have been defined into the template, and then work at defining the activities that should be implemented for each of the elements of the framework to reach the stage that you had, the strategy and the final stage and the objective you have set for each of these elements in the framework. And then last but not least, which is not necessarily an easy exercise, but of course a very important one, to cost the action plan, right? And to nominate someone in charge of the implementation of that plan if this is not already being done. The whole idea here is at the end, you have a comprehensive document that you can use to present directly to potential donors. And this really in a comprehensive way, right? By covering all the 9 elements of the framework and by providing an action plan, trying to address the gaps that have been identified across, you have one complete picture that will also contribute to the long-term sustainability of the implementation of the plan and therefore of the geo-enablement of the health information system. There's several slides here. I mean, quite a lot today. There's a lot of text. I'm not going to go in too much detail. I put all of these in order to really, for you, to have all of that as reference when you are looking at the development of the plan. First here, you have some general consideration about how to go about the development of the plan. This might seem obvious, and this does not necessarily only apply to the geo-enablement, but actually the development of any plan in general. First one is, of course, to be inclusive. It's important to have, therefore, a focal point being nominated for each MOH entity and partners and make sure that they are involved, of course, from the beginning of the development of the plan. That's part of making sure also that everybody all feels that it owns the plan, that it's part of the overall process. Make sure to also have use case, right? To really look at the plan to address current public health priorities, ideally that are included in the National Health Plan, because it will then link your plan directly to these priorities and therefore the strategic aspect of the implementation of the plan. It's important to build also on already existing, I was about to say secondary plan, but they are not secondary, but other plans which are also going to be taking into account or benefiting from the result of the geo-enablement. I mean, I'm thinking about program-specific or intervention-specific plan, for example, right, to make sure that it connects to this, that it's going to contribute, that the final product of the plan will contribute also to those program-specific plans. Important to leverage champions, local champions, within the Ministry of Health, of course, but potentially in other institutions that are active in the countries. Critical to leverage local capacities, of course, as usual, and to look into not only the private sector, but also the academic sector, for example, due to, for example, the longer lifespan, I mean, the more sustainable aspect of their program and capacity. And then also try to, in relation to that, benefit from what I call long-term coaching instead of this one-off training session, right, with someone coming out from outside the country, giving a training during 1 week and then leaving and there is no more support, right? So better to look into options that will provide really this long-term outline and support, because when you in the management and use of geospatial data and technology is like many other type of data. It's not something you do once every now and then. This is something you have to maintain continuously, simply because geography evolves through time, right? And so you need to have this capacity to maintain all of this content and the products you're going to be generating. Also, some additional consideration. Good to start by strengthening the central level. I mean, you can do it in parallel with the subnational level if you have enough resources, but it's kind of following the TOT kind of approach, right? Is if you have this capacity at the central level, you can also more easily afterwards, when it comes to geospatial data and technologies, the management of master list, etc., kind of then expand these to the subnational level and have something which is going to be strong. Of course, depends again on the context of each country. Use case, again, and applications as the driver, right? Don't use the technology as the driver. The choice of a particular IT solution or a GIS software should not be the driver. The driver should be really what you will do with the GIS-based product that will be generated through what you are basically establishing. Get the MOH staff to do really as much of the work as possible, even during the implementation of a pilot. I mean, using the pilot as a way to get staff to learn on how to deal with geospatial data and technologies, the best way to learn. So this is really something to take into account. Again, don't be afraid to implement action plan in phases. In some countries, I mean, in geo-enabling the information system can be something very new that requires a lot of adjustment, even in the way people have been basically doing their own activities in the programs, and therefore going by phase, slowly increasing the number of the area that is covered by the project, or the number of interventions that are being covered is a good approach. And in relation to that, especially at the beginning, I would recommend not to go for action plans that are longer than a year. Generally, we count 8 to 9 months for the implementation of a pilot, which is providing the opportunity to regularly assess and adjust the plan if it's needed. And of course, there is always delays like any other particular projects, things that you were on it, not expecting at the beginning, especially when it comes to accessibility to data, for example, and all the different processes that can be linked to this. And then last but not least, of course, think about the sustainability of the technical capacity, right? There's too many geo or GIS-based projects which are active over the duration of the project, and as soon as the project is over, basically the whole activities fall, the technical capacity that were established, as well as other common assets such as data or registries, basically fall apart. So really thinking about this from the development of the action plan. Again, this is not specific to something like the integration of geospatial data and technologies in the Ministry of Health business processes, but it very much applies here as well. So let's look a bit about some of these elements and how you are integrating these into the action plan, right? starting with the vision, as I was mentioning earlier, that's really important to start with this, like many other activities, kind of defining where do you want to be in 5 years or 2 years, even short or long-term vision. You have here examples of visions actually that have been defined as part of some exercise of developing this kind of action plan in a few countries. So you have two which are related to 2030 and therefore the SDGs, of course, or you have one in the middle here, which is more generic, which is lacking the time component, I will say here. Very important to define what by when actually in your vision. And this is the first piece of information that is integrated on top of the action plan template that we have developed. Once the vision has been developed, it's important to be looking at what are the objectives and also the implementation period that the plan will cover, right? And the vision, again, can be on the long term. It can be 2030, and by 2030, all the programs are fully benefiting from geospatial data and technologies, but your plan might be, for example, as it's mentioning here, covering only the next 2 years, right? So this is the first plan based on what has been identified. We're not going to go beyond 2 years, and we're going to be having a first set of specific objectives that we want to achieve. What's important is really to base this objective on the result of the geo-enablement level assessment, and also to make sure that these objectives are clear and are achievable, of course, during that period that has been set for the implementation of the action plan. And again, in the template, you have a place to capture this objective as well as the temporal extent of the implementation period. So here you have example of three objectives here, one being to strengthen the technical capacity at the central level, the MOH of the Ministry of Health at the central level when it comes to the management and use of geospatial data and technologies. Demonstrate the benefit of the geo-enablement of the health information system. That's very often the first step as well. People are convinced that definitely there is something into using GIS, into using geospatial data, but there is a need to convince to integrate that into a larger investment or into the national health strategy, for example. So implementing a pilot project that are covering a certain set of use case is a very good starting point to this, to demonstrate those benefits. And then the third objective here is in relation to the sustainability to the next step, right, is to be able to build on the result of the pilot project to scale that up to the rest of the country and institutionalize the capacity that have been developed, and these down to the subnational level. So this is a real example of objectives actually coming from a real plan that was developed in one of the countries. So now we have vision, we have the objectives. The next step, as I was mentioning earlier, is to transfer the information from the HIS geo-enablement level assessment matrix, right? You might remember from previous module that the result of the questionnaire is placed in this matrix, and there is also a template for this matrix that you can find in the HIS geo-enabling toolkit. And you can directly take this information, part of the information from there. The first information is the current situation or gap, right? That where the health sector finds itself right now across the 9 elements of the framework. So for example, here, the current situation, we are looking at governance structure here as the framework element. The current situation is that there is no governance structure that has been established right now, right? So this information, which is the directly the level can be directly copy and paste, or here it's expanded a bit, right, into the section of the template, which is dealing with governance structure and the presentation of the current situation and gap. And then also, as part of the assessment, there might have been some comments, right, which is important to carry over as well in the plan. Here, in this case, there is a comment that there was already an attempt to establish a governance structure in the past, but it did not work out. So this is also something that can go into the action plan directly, because it provides some additional context in relation to the activities that can be defined, right? One of them being here in this example, it could be, for example, that you want to look back at these or the term of reference of these governance structures that was in place back in 2020 and revisit maybe this term of reference as part of the new plan implementation. So already two of the information that comes directly from the assessment can go directly into the action plan template, and these for each of the 9 elements of the HIS Geo-enabling framework. The next set of information that can go in there is the result of the exercise from the previous steps, right, which was the definition of the strategies meant to be implemented in order to fill the gap, right? So you have also a space in the template there to capture this information. So in the context of the governance structure, the strategy which has been identified to fill that particular gap, right? Because right now there is no governance structure in the Ministry of Health. So the strategy that has been proposed is to create a technical working group to support the implementation of a pilot project that will be serving as the starting point for a governance structure. So here, not a real governance structure, but the first a technical working group that will oversee the implementation of a pilot project, and then the lessons learned from this technical working group will lead to the establishment of a sustained governance structure. And then the implementation level that has been defined, and it has been identified that this technical working group should be implemented at the national, at the central level, right? So once you have reached here, so you have the vision, you have the objectives, you have the period of implementation of the plan, and for each of the elements of the framework, you also have already contextual information about where are we today, where do we want to be, which is defined by the benchmark of the framework itself, and what is the strategy to fill the gaps, and at what level should this be implemented. So we already have quite some information that is integrated in the plan based on what has been done previously. So once this is done, the next step, which is something which is more time consuming, is to say, okay, I have my strategy, I know what is my gap, I know what I need to reach. I want now to define what are the activities that I should be implementing in order to basically fill that gap. So for each element of the framework, there is a specific part of the template where these activities can be captured in terms, described. First of all, what is the activity anticipated to achieve? What is the target group? So who is supposed to be involved in the implementation of this activity? Who is supposed to be or will be responsible for this activity? When is it supposed to start and anticipated to end? At that stage, you are not capturing the information about the budget, right? This is something you will do later, but what you can define is already expected, anticipated deliverables for each of these activities, as well as potential monitoring and evaluation indicators, right? And you will try, you will list ideally these activities in the chronologic order where they are meant, you think they are meant to be implemented as part of the plan. And to help with this particular step, because that can be, again, quite time consuming, what we have done is we have developed kind of a bank of activities, if you want, which is based on the implementation of the framework in other countries until now. And so this bank of activities is organized according to the different elements of the framework. You have a screenshot here. You have the link in the slides. You have it also in the toolkit. And for each, you see you have a worksheet for each of the elements of the HIS Geo-enabling framework, and you have them organized according to specific thematics. So you can basically pick and choose from these activities, include them into your plan, in your template for each specific elements of the framework. You can, of course, add to this. This is a non-comprehensive, it's quite comprehensive list already, I should say, but of course you have the possibility to add additional activities that you will not see there. What's important to mention, of course, is that the activities that are linked to the operationalization of the application of geospatial data and technologies, right? These applications that you have listed here, these goes under the use case element of the framework, right? The top of the pyramid, which is the ultimate goal, is to have a geo-enabled use case. So anything which is linked to the operationalization of these different use case, applications here, sorry, are themselves put under the use case element of the framework. The only one which is not mentioned here, the only application which is not mentioned here is the master list one, georeference master list, because this is directly one of the elements of the framework. So you have one element that directly deal with the georeference master list. All the other application goes under use case. Then once you have done all of these, the last part is to cost the plan, right? And also, first of all, to look at the consistency in terms of timeline, right? Because when it's documented under the form of a table like this, it's not necessarily easy to see if and how each of them are actually fitting together in a logical manner. So it's useful to develop a Gantt chart also in addition to this plan, in order to make sure that all the activities are actually flowing nicely together, and there is no inconsistency, something that suddenly will need to be finalized before another activity, and it's not the case. So that's a good thing to test. A list here of activities that can take more time than generally anticipated when looking at developing the timeline, right? And looking at the start and end of each of the activities. I'm not going to go into detail. Again, this is not specific to geospatial data and technologies, but you will recognize things. This is something that is coming from a list that is coming from the Geo-enabling micro planning handbook. Last step, once all of this has been done, and you can do it earlier in the process if you want, as I was mentioning earlier, if people are really having a clear idea of the cost, but generally it comes towards the end, but also very much in parallel with the timeline, right? How long will it take to implement an activity will have an impact on the cost. It's to be defined not only for each of the activity, but also in relation to potential external support, right? From consultants, they might, including the travel, question of allowance, right? For staff to also attend specific meeting or training, things like internet connection and also access to a common drive to share data, right, is also something that needs to be taken into account. Sometimes it can be included in an activity, sometimes it's not. It's important to make sure this is included and you have a budget that is as detailed as possible in the end. That will help avoiding any resource shortage during the process, and also manage to get donors on board, right, to be willing to sustain the implementation of the plan. In relation to the definition of the budget, there are several documents which can be used as a reference that can help not give you the real values, but more giving you some indication about what are the things you should be careful about when you are estimating cost. The first one is the UNICEF guidance on the use of geospatial data and technologies for immunization programs. And you have here also the document from Gavi, which is a rapid guidance to help basically also using geospatial data and technologies in the health context. What you have here is a screenshot of the French version, but you also have the English version. All of this is in the Google Drive. So you have some indication of the things to take care about across all the elements of the framework. Even if this is in relation to immunization, that's very much applicable to any other program or intervention. So these are good reference documents when you are looking at developing the budget. And you also have considerations in the Geo-enabled micro-planning handbook. So by looking at these three documents, you should already have a good starting point of the things that you should be thinking about and including in your budget. So this is the other part, again, related to immunization, but applicable to any other programs or intervention. Okay, let me see if we have, no, we have no question so far in the Q&A, and I don't see anything in the chat. So let's move to, what time is it? 1:52. What I'm suggesting is we could do a 5-minute break now, just 8-minute breaks until the hour, and then we will continue to the next 3 sessions for today. That should bring us to the end of the next hour. So let's have a break for the coming 8 minutes, and I'll see you again at the hour. Thank you. Thank you, and welcome back, everybody. It was brought to my attention that the link sent at the beginning of the module today were actually not sent to everyone. So thanks to Geraldine, who has already sent a few of them. I'm putting in the chat right now the link to the evaluation form for the training workshop. We'll really appreciate if you can take it. Really a short questionnaire, should not take you more than 5 to 7 minutes to complete it. It will really help us to make sure that, first of all, the training workshop was appropriate and how we can improve this for any other training in the future. In the meantime, we'll move to the next step. So now we have develop an action plan, costed action plan with vision, clear objectives, time frame, person in charge, and then for each element of the HRS Geo-enabling framework, we have also a strategy that has been defined in order to fill the gaps and reach the ideal situation for each of these elements of the framework. we have defined also activities for each of these elements that are costed. Therefore, we reach and hopefully funding has been identified to be able to implement this action plan. And therefore, the next natural step is, of course, to implement it. I'm not going to be going into details about the implementation, of course, because it will very much depend on the gaps identified in each country, and therefore the, of course, activities that have been defined to implement those, fill those gaps, sorry. But I wanted to go through some specific elements that it's important to take into account. Again, not going to go into detail, but really kind of the main things to think about before, during, and after the implementation of the action plan. So starting with the before, of course, very important to make sure that everybody has a clear understanding of the plan itself, that again, there are focal points that have been nominated for each of the stakeholders to be involved in this implementation. Might be the same focal person as those that were identified for the development of the plan, but it can also be different one because it's maybe at more technical level. Make sure that there is a good way communication channel, right? Starting with the contact database, a clear definition of roles and responsibilities of all the people involved in the implementation. Again, mode of communication, right? Not only the contact database, but how will they communicate between themselves? And also having this online coming working space, which can be of different type. As you know, there are some limitation in using something like Google Drive, but there are also advantages in using Google Drive. So there might be more than one working space to be used to facilitate the implementation. Now, during the implementation itself, and again, that apply for any type of plan that you're going to be implementing, it's important to track the implementation, right? Monitoring and evaluation. Ensure that really there is someone in charge of managing the overall flow of financial resources, managing potential risk, right? I mean, continuously, basically monitoring what is happening and anticipating potential risks toward successful implementation. And again, also having someone that is really, and that can be the role of the project implementer, right? To ensure that there is a good flow of communication among the different parties. And this is something that might be sometimes underestimated, especially when you have people from different cultures involved into the implementation of a project. Now, when you are implementing the plan, especially when we are looking at geo-enabling a program or an intervention, one of the first steps there is to really address during the implementation the availability and quality issues linked to the input data that will be then used to generate the different GIS-based product. And to ensure the quality, I mean, that's sent back to module 4, right? Which we spent quite some time looking at these issues. Again, important to make sure that there is good SOPs that are put in place, that there is quality control measures that are there, that there is the appropriate technical skills that is used, that all the equipment is functioning properly, including, for example, the device that will be used for field data collection, that there is really good training that is developed, good training, meaning it's adapted also to the participants to this training, that really all the documentation that needs to be used is accessible also to this staff, and that you have this all monitoring again, measures, Actually, there's something duplicated here a bit. And then have, as part of this, also don't hesitate to have validation exercise taking place to really ensure the highest quality of the data possible, because that will, of course, have a direct impact to the quality of the product that are created, and therefore the decisions that will be taken out of them. Now, once the quality issues have been addressed, and then you start looking at for others applications of geospatial data and technologies that we have been looking into can be operationalized to generate a specific product, right? There is also a certain order to follow in relation to that, meaning that the first thing to be done is to make sure you have all your georeference master list in order, right? Because they will serve as the ground reference, as part of the ground reference to ensure the quality of the data and the product. So make sure that all your master list in place together with the associated geospatial data. So we're talking about administrative units, for example, province, district, that not only you have the master list, but you also have the associated GIS data that contains the boundaries of these administrative units in order. Then based on these, you will be looking into generated the spatial distribution and estimate for the target population if this is needed, right? That's the next application of geospatial data and technologies. And then after that, look at the conducting your geographic accessibility or service location route optimization analysis or modeling using the data that you have prepared beforehand, including the georeference master list and the population distribution. And at the end, you will generate thematic maps based on the result of the other three applications, right? The use of GNSS, right, which is the last application, is something that is most likely going to be intervening at the level of ensuring the quality of your data, right? When you fill the gaps in the georeference master list, for example, to get the geographic coordinates of all your health facilities, vaccination posts, etc. Now, that's an ideal kind of scenario, right? Succession of work, but in some cases, especially in an emergency context, right, or time constraint case, the creation of thematic maps might start earlier, even if some of the work has not been finalized, right? You might have a first set of thematic maps being created on the basis of the existing georeference master list with all the spatial distribution of the population, or even the result of your accessibility analysis, for example, or other type of analysis, because these kind of maps will already be useful for the implementation of the program or the intervention. And then at a later stage, more advanced, we can say thematic maps are created, or not at all, depending on the context. So again, that's an ideal scenario. If you can implement it in that order, I would recommend you to do so. Depending on the context, you might have to change that order a bit, especially when it comes to the creation of thematic maps. Now, once you have generated those products, it's always very important to have a critical look at them, right? Make sure that the products, first of all, help addressing really the challenges or the needs or the priorities that were identified at the beginning of the process, to make sure that this product meets the purpose, content, format that have been defined, right? Also earlier in the process, and that if there are any limitations, right, or gaps that could affect the use of these maps for taking decisions, right, make sure that this is documented. Typical example, you might have some location of health facilities missing on a map, right? You might have 103 health facilities in a given province, and then you don't have the coordinates for 6 of them, so 6 points are missing on the map. You need to make sure that this information is clearly appearing somewhere on the map to really inform the users about these particular limitations. Going through these questions, right, can be, as mentioned here, part of an evaluation or validation workshop when you have, again, the time, depending on how the intervention, I mean, how fast you need these products to be used. But in the context of micro-planning, for example, something we are currently implementing in Cambodia, and we are about to generate the first set of products, there will be a evaluation and validation workshop at both the central level and the subnational level to see if and how the products are easy to be understood by whom they need to be used, and if any adjustment needs to be done on those products before they are really implemented into the routine implementation of the program or the intervention. So some specific also elements in relation to the georeference master list, right, which is at the beginning of this 4th step I was mentioning earlier, and really one of these foundational data sets that constitute the ground reference, right, for the application of geospatial data and technologies. So there might be some data collection taking place as part of the implementation of the action plan. Some of the data being collected might be meant to be reintegrated into the master list, right? And when this is the case, that should be done as soon as possible. And then the master list, updated master list being accessible to all the stakeholders, because again, it serves as ground reference, right? Once this has been done, you know, you can at the same also check that the associated geospatial data that might be collected. So there might be a new district that has been created. So there was a need to adjust the district boundary GIS data to match this change. So all of this needs to be aligned. And at the same time, you want to make sure that everything is clean in your master list, right? In terms of the label, for example, for the data element, that this is aligned with what was defined originally, what is mentioned in the data dictionary. You want to also define and implement a unique coding scheme to uniquely identify each of the geographic objects if it doesn't already exist. That's a really critical element, especially in countries where the name of a particular infrastructure or place can have different spelling, right? So the unique identifier is what will really ensure that everybody is talking about the same place. And also make sure that the master list, as we talk, I think it was in module 4 again, contains really this data catalog, right? This simplified data dictionary, as well as the metadata that will really allow the user to make full use of the content of the georeference master list. So that if that has not been done before the implementation of the plan, the implementation is the right moment to take care of all of this. And also, again, I was mentioning already earlier, a bit too fast, the question of the geographic extent, right? The geospatial data attached to it. It's really important to ensure that this geospatial data, for those who are knowledgeable with the structure of this spatial data, ensure that what we call the attribute table of the geospatial data set, the content of this attribute table matches the content of the corresponding master list. And again, also that the geospatial data set is accompanied by the necessary metadata in order to be, again, facilitating its use in different contexts. Now, when it comes to thematic mapping, also a set of important things to remember. in relation to the implementation of the action plan. First thing, of course, this is the not only the most visible, but most probably also the type of product that will be generated the most as part of the implementation of an action plan. So it's really important to put specific attention to the creation of these maps and their content, right? There's a specific process to be followed, which is actually documented in one of the Health GeoLab guidance document. This is also something you find in the Google Drive or the Health GeoLab website. This document this guidance does not only describe the whole process, but also provide you with SOPs on how to implement this process in different type of GIS software, so that you obtain a map that really contains all the elements that are necessary to make it a good map, a map that will be useful for decision making and planning. Now, there are also other additional considerations in relation to creation of thematic maps, which are listed here. This is really for the person in charge, the staff is going to be creating those maps in terms of ensuring that all what we call standard cartographic elements are on the map, like the north arrow, the scale bar, the legend, etc. Make sure that it's easy to understand, right? That the map is really, can be really gone through by the people, the users, without having to really kind of even contact back the person that has been creating the map to understand what the map is about. Part of this is also to make sure to not put too much information, too much geospatial data, too much geographic information on a map. Sometimes it's better to have more than one map to really facilitate for the understanding of the message that these maps are trying to pass. Also, if these thematic maps are part of the digitalization of a particular process, like when using sketch map, for example, in microplanning, that's part of the geo-enablement of microplanning, right? Which is promoted by several institutions, including UNICEF. It's important to make sure that whatever features, whatever information are on the sketch map are also reported in the now digital version of it, which has been created using a GIS software, naming convention, colors. I mean, all of this, I mean, I don't want to say it's an art. I mean, some people are saying it's an art. Most probably that's the case. I mean, creating these thematic maps require experience. And the more maps you create, the more you kind of become expert in identifying what makes a good map, and that will make a difference to support decision making and planning. Few other things which are important: the appearance of the map, right? Appearance of the different elements on the map, the size of the map depending on its use, right? And also, again, there are potential ways. I was mentioning the case of a map that is not complete earlier, where some facilities are missing on the map. I mean, you can very much consider also making this map as something that can be interactively basically completed, even manually, as the information is available, while waiting for the information in the digital format to be basically integrated in the original data. Of course, you can have digital version, right? You have paper map, you have online version of the map, and which have additional capabilities, right? That allows you to zoom in and zoom out, for example. So again, some things to be careful about when you are doing this. But in general, it's good if you have the possibility to have in place a feedback mechanism right? So that people can provide feedback on the maps to avoid that, sometimes it can happen that the facility is on the wrong side of the river, and because of that, the credibility of the map falls, while it might be something easy to fix, right? And so being able to get the feedback from the users on the maps is something that can help avoiding this kind of issues. And also making sure that as much as possible, you have even interviews being put in place with the users of those maps to make sure that they are using them, most of all, right? How they have been using them, and if there are ways in which maps could be improved in the future. I mean, as technicians, we always think our maps are beautiful, are wonderful, and they should do the thing, but sometimes we miss few small things which are in the hands of the users that we might not think about. So getting those feedback from the users as part of the implementation of the plan is a very important task to look into. Now, the other also very important thing, and that is particularly applicable in the context of the digitalization process, for example, is that whatever new product you are coming up with, and not only maps, it can also be tables, etc. When at some point, when they have been judged useful, when, for example, they are more useful than the paper-based map, there will be a need to integrate the use, and I mean, first the generation and then the use of those GIS-based map into the program or the intervention, right? And that can happen not only in terms of the map, but that can also be in terms of some of the work that has been done as part of the process. You might remember the examples I provided during, I think, module 4, where the result of the exercise aiming at identifying the geography of the micro-planning intervention actually helped realizing that certain settlements were missed simply because of a semantic issue, because the way the geographic features, the geography of microplanning was defined was giving some doubt concerning certain type of settlements to be included in the microplan. So even before you reach the final product, things like this conceptual data model, what resulted from the conceptual data model exercise, or even the master list, right, of facilities, of concentration point, of settlements, also might benefit the program of the intervention, and their use, I mean, their generation and use might also require to be integrated into the routine process. So there has to, I mean, it's important to think about how to do this integration. And then there is integration of the final products themselves. And again, it's not only the thematic maps, but it can also be tables or graphs. And all of that might require not only some time, but also some changes in the way people are looking into the process. And when you have a specific intervention that has been running for a long time, coming up with new product, new things, new ways to look at this certain step of the process can take some time, right? And not only at the level of the users, but of course at the level of those in charge of the program itself. So this is important to take into account and to look into that. And I'm afraid that my computer is freezing. Can you still hear me?
Yes, Steve, we can hear you.
Okay, but my computer just froze. Okay, great. It had to happen. It did not, I mean, it happened once with one of the modules. I might have to reboot quickly. Just give me 30 seconds and I'll be back online. Sorry for that, guys.
Yes, we can hear you, Steve.
Thank you. Sorry, guys, for this. It had to happen, of course. Okay. So, yes, we were talking about the integration of the final product into a program or intervention. So there are specific actions that are required in order to perform this integration, right? I mean, and they are listed here. I started describing them a little bit earlier when my computer froze and I was also expecting it to restart. So again, important to look into this as part of the implementation of the plan. You have here also the example, I mean, again, the example I was mentioning earlier in Myanmar about the integration of the result of this work on the identification of the geography of the microplanning context that led to define different types of EPI communities to be covered right during immunization, and which led to adjusting the content of the microplanning forms and associated SOPs. Also here in relation to how the master list integration in a program or an intervention should take place. I already mentioned that earlier. I'm not going to go too much in detail, but important to make sure that this integration is also done in such a way that you have also a registry or a common registry that is being set up, right? So that you don't have multiple versions flying around, but you have really one place, one repository where everybody is taking this master list from. So that you ensure that everybody is always having access to the same version, to the most up-to-date, complete content of these master lists. And also in terms of the tables and the graphs that are presenting the statistics, etc., as well as the thematic mapping maps that have been created. Again, also here you have a set of suggestion recommendations on how to basically look at integrating those products into what used to be the way to do the integration, I mean, the implementation of the intervention prior to these new products. Okay. Yes. The importance of the timing, right? When do you basically integrate these new products into your program or intervention, which will very much be depending on different factors, including the emergency of the situation, right? I mean, if you are, I mean, you have your new set of products, but you are in an emergency context like a disease outbreak, of course, that might not be the most appropriate time for new products to be, new maps, new table, new graph to be integrated in the usual process that people are following in this kind of context. Another example, still linked to microplanning, might be that the microplan is already, I mean, you have a specific campaign intervention depending on a microplan, and this is already the implementation of the plan is already too far advanced to change the process. Now you better wait until the next round, right? Or there is, like I was mentioning, it's not necessarily only at the level of the product themselves, but there is a need to really change the way people, the change management is really important. So the integration requires really much more effort than initially anticipated. So all of these will plead in favor of having this integration being postponed, right, until it's the right timing to be integrated. And that's very important to ensure really, again, a good buy-in also from the user side. Okay. Let me quickly, so this ends what I wanted to share with you from the perspective of the implementation of the plan. Again, these are more kind of based on lessons learned and some reference material for you to, some certain things for you to think about when you're doing this. Let me just quickly look at the Q&A. No, there is no answer for the moment. I have not seen anything in the chat neither. So I think we are fine. I can move to the next step of the process, right? So now we have implemented the plan. And so after the implementation, that's where it's important to assess the implementation, document also this implementation, and as much as possible, sustain also what has been put in place during the implementation. So this is step 5 into the HIS Geo-enabling framework implementation process. That's the last step before closing the loop, which is something we're going to be talking about also a bit later before the end of this module. So when you look at assessing the result of the implementation of the action plan, there is certain set of challenges and lessons learned that it's good to identify and also document. And this is coming again from the Geo-enable microplanning handbook. That concern difference in budget and timelines, right, compared to what you have anticipated, especially if you implement that at the pilot project and you're planning to scale this up, to identify what this difference would be useful to adjust in relation to the scaling up. Actually, most of the other ones also are in relation to that, where the adequate technical capacity in terms of skills and volume of this capacity is sufficient to operationalize the applications, were there any gaps, finally, in terms of the standards, the protocols, and the guidelines that have been used, were there insufficient or inadequate technologies, issues in data availability, quality, and accessibility, difficulty of the user to read or understand or trust even the or use the final product, etc., etc. I mean, all of these are important elements that should be identified and documented. Really, and if you have defined key performance indicators, right, at the time of developing the action plan, like these M&E indicators that are in the action plan template, you can use that as a reference to document these. And again, especially important if you did this as part of a pilot project and you are thinking in the next phase to do a scale up. So documenting all of this is going to be very useful in this context. Now, what's also important in relation to this is to have a good understanding if and how the products have been used, right? I mean, I was mentioning that earlier during the implementation, if you can do this, but if this cannot be done, or if this can be done in addition to this particular process during the implementation, it's good to do this. That can be done under the form of a survey or some interviews, right? Aiming at those that are supposed to use this product, right? Did you use them? How did you use them, etc.? The same questions I was mentioning earlier. It's good also to document, of course, the impact that the use of these documents of the geo-enablement in general had, right? I mean, you have an example here on the impact that the use of specific maps in a context in India for microplanning have brought. Sometimes, I mean, you might not have such a quantitative values being available unless you perform that over a certain period of time, right? That allows you to really see the impact over several rounds of implementation. But you might sometimes also have a direct feedback that are, again, not quantitative, but can be qualitative or informative in nature, which is also very insightful. And these, again, these feedback, like when you perform that during the implementation of the plan, might lead to adjusting some of these products or even generating new ones, right, based on this feedback. Now, it's also important after the implementation of the plan to document the result of this implementation. And that can be under the form of different documents, right? Again, very important, especially in the context of scaling up. Also, for simply the use of the approach in other countries, right? Or even other programs inside the same country. So different documents, which can include overall, I mean, kind of a general document that describe the overall process for the geo-enablement, right? From the beginning of the implementation of the process until the end. This is generally important for the donors, right? Those that have invested in the geo-enablement of the program or the intervention. And then the second type of documents are detailed technical process, right, that you follow, that have been followed from the beginning until the end. And again, that's very important for the scaling up. That can include also challenges and lessons learned, but really documenting all of these. And then also feedback and challenges, lessons learned from the integration and use of the product in the micro-planning process. That's useful also from not only from an auditing perspective, again, but as a reference material for use, again, not only by other countries, but also by other programs in the same country. Just an example here, this is the documentation that resulted from the pilot project implemented in Mozambique in relation to geo-enabled microplanning. So what we have done is here really a documentation, this is the technical documentation that you have here that allows, because it was implemented only on 2 districts, now it's been scaling up to 36 districts. So this documentation, these are really, you have not only the technical, the data specifications, right, and ground reference that have been used, but you have specific SOPs that were used at each step of the process so that the team that now will be implementing the approach on another district can directly take those documents and re-implement them in the new district where the scaling up is taking place. Another type of documentation that is important is to do that in a format, I mean, documenting the whole process in a format that can be shared easily or easily digested, I would say, for example, with donors or with the managerial level in the ministry. So this is kind of a simplified, short, if possible, as visual as possible. I will say that's one of the advantages, of course, of using geospatial data and technologies, is you have these beautiful GIS products, right? We say one image is more than 1,000 words. So kind of developing almost, we can say, some kind of marketing material that demonstrate the benefit of the geo-enablement when there was a need to do that, right? Or to leverage additional resources, right? Again, to be able to show what has been done in the context of the pilot project and get financial resources for the scaling up, for example. And in this context, I mean, StoryMap, there are other kind of media, a very interesting support in this regards, as it allows to include dynamic maps among other types of media, right? So this is something to consider, and we have been doing that for all the countries where we implemented the HIS geo-enabling framework, and that has always been very well received as a way to summarize the work that has been done. Now, Beyond the documentation, there is, of course, the need as much as possible to sustain what has been established in the context of the implementation of the plan. And that concerns first storing, maintaining, improving, updating the data, right, and the products that have been generated during the process, which send back to the concept of registries, right, the sustainability of the technical capacity, et cetera, et cetera. Of course, there is, again, the scaling up, right? If the first phase of the plan was implemented at the pilot project level, then there is a need to go to the national level, the need to ensure the long-term sustainability of what has been also established in terms of the what we'll say the foundational element of the geo-enabling framework, right? And then also, last but not least, planning for the next iteration of the HIS program or intervention geo-enabling process, right? Again, you might have to do several rounds until you fill all the gaps. The situation might evolve also in the countries. The priorities will change, right? So on a regular basis, it's good to restart the cycle and to look at potentially developing new products, the need for new skills to be developed or strengthened, et cetera, et cetera. So all of these should be part of the after plan implementation to look at the long-term sustainability of what has been done. So just going to give you some pointers, I will say, for each of these elements, without, again, going too much in detail, but really wanted to have that on records, right, on those slides. So first one, storing, maintaining, improving, updating the data, right, generated during the geo-enablement. Because you need to continuously keep your data updated, geography change through time, right? And again, going back to the question of registries and common geo-registries, the concept also of national spatial data infrastructure, right? Connecting the health sector with the cross-sectoral mechanism, if it's in place in the country. Now that applies on the data side, but it's also applicable on the products, right? Because as the data is changing, there is a need to change also the products. These product needs also to be backed up. They need to be organized and stored somewhere, right? So all of the thinking about this that you have to do for the data also has to be done in terms of the product, making sure also that it's easy for the user to identify if he's looking at the product created 2 years ago or the product this year, which goes back to all the elements that should appear on a good thematic map, for example, right? Also looking at when do you actually, it's a good time to update those products, right? For some interventions that can be done on a yearly basis, right? Others might be on an ad hoc basis. So there is a need to look at when it's appropriate to do these changes, depending on the context, on the intervention itself. And then also now, independently from storing all of these, there is a way to have a really mechanism in place to treat requests for modifications, right? I mean, you might be responsible for managing these master lists, for example, or the creation of specific thematic maps, or even the updating mechanism for the population estimate or the spatial distribution of this population or specific analysis, right? There has to be a mechanism in place for treating those requests, and there will be a different mechanism for each of these different products here, right? and that has to be supported potentially, especially when it comes to the master list, again, by specific IT solutions like the registries we have been talking about. Now, so that's in terms of the first two elements. Now, if you have to be looking at the scaling up of the action plan, right, as part of the next phase, that should be part of a new action plan in a way, right, the scaling up. And then depending on the resources that you have at disposal and the project, you might have to do a scaling up in multiple phases, right? Like in the case of Myanmar for the geo-enablement of micro-planning, it started with 2 townships, then it was expanded to 5, and then it moved to 49 before going hopefully further than that. So you need to really kind of plan and you do that, of course, based on all the lessons learned from the implementation of the previous plans, right? And so this is where, again, the documentation I was mentioning earlier and the capture of the differences between what was anticipated and what finally happened in terms of budget, in terms of timelines, is becoming useful to be able to develop this, the best scaling up strategy possible. And then the last elements on the slides I was mentioning earlier, no, it's not the last element, the fourth one is, of course, the long-term sustainability, especially of the bottom part of the pyramid, right, of the HIS geo-enabling framework, which connect to the institutionalization, right, and of these elements as much as possible inside the health sector, right? Integration of these elements as part of the regular budget, and as much as possible in alignment with the national spatial data infrastructure, which is again this cross-sectoral mechanism. And so doing this makes it more cost-effective, facilitate coordination, right? And so it's important to maintain this on the long term as much as possible. And then, yeah, the last one, which is this one, the fifth elements, was the planning for the next iteration, right, of the HIS program or intervention geo-enabling process. And you might remember, right, I mean, if you look at the geo-enablement of the health information system as a cross-sectoral system, the process is a little bit shorter. If you look at geo-enabling a program or an intervention, you have these 2 additional steps, and this is the process we have been using as a reference for the context of this particular training. But in both cases, this is a loop, right? This should be repeated on a regular basis. Again, as I mentioned earlier, address new challenges. I mean, right now, climate change is, of course, very much on top of many priority lists that requires new thinking, new collaboration, new potential products as well to be integrated into the process. Okay, so this should be, yes, this ends the session about the kind of what should happen ideally after the implementation of the plan, right? In terms of assessment, in terms of documentation, and in terms of also the sustainability of what has been established during the implementation of the plan. So we are reached now the last session of this module and therefore of the whole training, during which I wanted just to give you a quick recap in the last 10 minutes we have here, a quick recap of what we have looked at, and also point again to some specific resources in relation to the implementation of the HIS geo-enabling framework in countries. The first thing is just to remind you about these 3 key graphs or schemas, right, which are complementary. The first one being on the left, being the strategic framework with the 9 elements that are meant to be in place and sustained for an health information system, a program, or an intervention to be considered geo-enabled, fully benefiting from geospatial data and technologies. In the middle, you have the implementation process. You have seen it today. This is how you basically manage to operationalize the strategic framework, or you implement it in countries. And then on the right, you have the geospatial data management cycle, which we look at in detail during module 4, and which is really kind of like the technical core of the process that ensure the availability, accessibility, and quality of the data, and therefore the quality of the products that you will be generating. So these three schemas are really the foundational one of what we have looked at over these past 6 modules. The other thing I wanted to mention again is, of course, the HIS Geo-enabling toolkit. This is the reference for the description of the framework, the implementation of the process. That's where you find also these different tools and references material in order for you to assess the current level of geo-enablement of your information system program or intervention, and develop an action plan to address the gaps that you might have identified. Mention also these 3 other documents, which are also reference documents, which have not only been used as reference for the development of the present training workshop material, but are also all 3 making reference to the HIS Geo-enabling framework to guide basically the structure of the elements that needs to be covered, as well as the process. So in each of them are covering a specific aspect, they have a specific purpose, they have a specific target audience, and so they are complementary. There are some overlaps, but I mean, these are really the 3 documents you will want to have a look at, in addition to the HIS Geo-enabling toolkit. If you want to look at geo-enabling your program, intervention, or health information system. As I mentioned, each of them make reference to the pyramid, to the framework, make reference also to the process, either in a similar way or a little bit modified way, but it's exactly the same elements. Some have a little bit more detail in the way they describe the process. So they are all these 4 documents. So the toolkit and these 3 are really kind of converging and trying to promote a common direction for supporting the management and use of geospatial data and technologies in countries, in the health sector in countries. Some additional useful tools that you find also in these documents, which are the relation between challenges from this WHO health system classification and specific application of geospatial data and technologies, which we have been using in the questionnaire, as well as reference during the first set of module of this training. Also, additional material that you find in the UNICEF guidance on the use of geospatial data and technologies, again for immunization programs, but can be contextualized and applicable to any other health program. And these resources you find in terms of the budget, which I mentioned earlier, from the rapid guidance for investment planning from the Gavi document, which covers 7 of the non-components of the HIS Geo-enabling framework. So again, examples on the usefulness of these different documents to help you with the geo-enablement in countries. And then you have all the material that we have developed in the context of the Health GeoLab activities, which are free resources. And that includes all the guidance documents I've been mentioning since the beginning of this training. All the training material, including this one, also you will find that there from the website. I'll show that in a second, the link to the website. Everything is freely available. Please feel free to use these. Yes, the link is here. This is the link to the Health GeoLab website. You have a specific resource page, a resource tab, where you will find all the resource material. You have a knowledge repositories also organized according to the elements of the HIS Geo-enabling framework. You have also the link to the whole training material, right? As well as also additional resources when it comes to accessing actually geospatial technologies. There are specific grants in every program. There's a new one that was just released actually by Esri, which I will add also on the Geolab website maybe later today. So you have a lot of resources there that you can use and leverage for your own context. And then for those, I mean, from the Asia Pacific side of the planet in particular, but we are also having some activities in the African continent. There's of course the Health Geolab Hub, which is this regional resource that help the health sector in countries to enable the health information system. We have activities and support across all the 9 elements of the framework. You have information and you can contact us also from actually the same Health Geolab Hub website. And I think, yes, we have reached the end of this module and therefore of this training. So I don't know, Sonny, do you want to give a few words to close the training?
Right, thanks, Steve. And colleagues, just want to say thank you on behalf of the UNICEF East Asia Pacific Region Office for attending this regional workshop from the beginning to the end. We applaud your persistence. We applaud your motivation, your drive to stay put from the beginning to the end of this section, this long series of webinar. We also want to thank the facilitator, Dr. Steve, for job well done. Please, as we have put the link on the chat, please endeavor to complete the evaluation. For those that meet the requirement for the certificate, we are going to check the attendance sheet, and of course, we will email you your certificates in due time. Thank you so much, and we ensure that you're able to put to practice what we've learned over the months. Thank you and stay blessed. Bye.
Thank you. Bye-bye.
Bye-bye.